Hey friends, today we are going to revise intracranial dural venous sinuses. There are the various channels present in cranial dura. They are formed in following two ways: by separation of two layers of cranial dura, by reduplication of meningeal layer. Some features: lies between layers of dura mater, have no muscles in their wall, lined by endothelium only, no valves, receive venous bloods and CSF, maintains equilibrium pressure. So, paired and unpaired dural venous sinuses. So, paired are in sky blue color. Paired sinuses are paired sinuses are sphenoparietal sinus, cavernous sinus, superior petrosal sinus, inferior petrosal sinus, sigmoid sinus, and transverse sinus. And unpaired are superior sagittal sinus, inferior sagittal sinus, straight sinus, and occipital sinus. Classification: unpaired sinuses and paired sinuses. So you can learn the unpaired sinuses by sister working in BPO. Like this trick I have learned from Marrow app. Unpaired sinuses, you can learn it by sister working in BPO. Superior sagittal, inferior sagittal, straight sinus, basilar venous plexus, posterior intercavernous sinus, occipital sinus. And remaining are the paired sinuses. Like paired sinuses are cavernous sinus, superior petrosal, inferior petrosal, transverse, sigmoid, sphenoparietal, petrosquamous. Levator palpebrae, rectus superioris, superior ophthalmic vein, sphenoparietal sinus, end of the straight sinus, superior sagittal sinus, vertebral artery, transverse sinus, superior petrosal sinus, middle meningeal vein and artery. There are about 21 sinuses. So cavernous sinus is very important for our exam. So we gonna revise it. Cavernous sinus, paired. The cavernous sinus, 2 cm long and 1 cm wide, is a large venous sinus on either side of the body of the sphenoid and sella torsica in middle cranial fossa. Each sinus extends anteriorly up to medial end of the superior orbital fissure and posteriorly up to the apex to the petrous temporal bone. Relations: superior optic chiasm, optic tract, internal carotid artery, anterior perforated substance, inferior foramen lacerum, junctions of body and greater wing of sphenoid. Medial pituitary gland, sphenoid air sinuses. Lateral temporal lobe of cerebral hemisphere and cavum trigeminal. Anterior superior orbital fissure, apex of orbit. Posterior crux cerebri of midbrain, apex of the petrous temporal bone. So here you can see roof by meningeal layer of the dura mater, floor by interstitial layer of the dura mater, lateral border meningeal layer of the dura mater, sphenoid sinus, medial border body of the sphenoid bone. And the relation on the structures passing through the cavernous sinus are, here you can see, lateral wall of the sinus 3, 4 and trigeminal first branch, that is the ophthalmic. So oculomotor nerve, trochlear nerve and ophthalmic nerve from the lateral wall, and abducent nerve and internal carotid artery inside. So from your lateral wall, oculomotor nerve, trochlear nerve and ophthalmic nerve, and inside it abducent nerve and the internal carotid artery. Okay, so here you can see through the sinus, internal carotid artery and abducent nerve and from lateral wall, oculomotor nerve, trochlear nerve, and ophthalmic nerve of the trigeminal nerve. And I am not talking about maxillary nerve because it is not present there. Sella thoracica, sphenoid sinus, sphenoid bone, and nasopharynx. Hypophysis, pituitary gland, optic chiasm. Tributaries. The cavernous sinus receives blood from three sources: orbit, meninges, and brain. From orbit, superior ophthalmic vein, inferior ophthalmic vein, central vein of retina, and from meninges, sphenoparietal sinus, anterior trunk of middle meningeal vein. From brain, superior medial cerebral vein, inferior cerebral vein. Clinical is cavernous sinus thrombosis, CST. The septic thrombosis of cavernous sinus may be caused by numerous communications. The commonest cause of thrombosis is the passage of septic emboli from dangerous area of the face, the through facial vein, deep facial vein, pterygoid venous plexus, emissary vein. So the pathway is like this. Here you can see facial vein, deep facial vein, pterygoid venous plexus, facial vein, deep facial vein, pterygoid venous plexus, and then emissary vein, and then cavernous sinus. Cavernous sinus thrombosis give rise to following signs and symptoms: severe pain in the eye and forehead due to involvement of the ophthalmic nerve; ophthalmoplegia, paralysis of ocular muscles due to involvement of the third, fourth, and sixth cranial nerves; marked edema of the eyelids with exophthalmos due to congestion of the orbital veins following obstruction of ophthalmic veins. Atriovenous communications. If the internal carotid artery is ruptured in the fracture bone of the skull, and arteriovenous communication or fistula is established between the artery and cavernous sinus, consequently arterial blood rushes into the cavernous sinus, enlarging it and forcing blood into the connecting veins. Arteriovenous communication give rise to following signs and symptoms: pulsating exophthalmos, the eyeball protrudes and pulsates with each heartbeat. A loud bruit, loud stolic murmur is easily heard over the eye. Ophthalmoplegia due to involvement of the third, fourth, and sixth cranial nerves. Marked orbital and conjunctival edema due to raised mark pressure in the cavernous sinus. Thank you.